All righty. Thank you so much for joining me today, Kelley. I appreciate it so much.
Thanks for having me.
Absolutely. All right. So before we get started, I would like to just start from a place, a kind of level setting. If you wouldn't mind just sharing a little bit about your own airway journey and how you landed where you are now.
Well, anybody that follows me knows kind of where I come from and why I'm here and my purpose. But for those who don't know me, I am a licensed dental hygienist and have focused specifically working in high volume pediatric practices for over 20 years in dentistry. And so you see, 50 to 100 patients a day, and you're seeing lots of mouths and you're seeing lots of oral defensiveness. And over the years, I was noticing mouths were getting smaller, tonsils were getting bigger, dark circles under the eyes were becoming more of the norm, behavioral
Yeah.
issues, and we're having to modify behavior in pediatric dentistry. It's kind of like psychology and dental interventions at the same time when you're working with peds. So I noticed that that was a characteristic. And so I had an experience with my nephew where I witnessed apneic events, and that kind of got me alarmed. And why is he, stopping breathing in his sleep? Why are his lips turning blue? And then it
Mm,
led me into a rabbit hole of researching and talking to my boss at the time about what we could do, what we could look for. And then I searched, and this term came up called myofunctional therapy, and I noticed that there was several offerings for courses and that my licensure would allow me to sit in and have this additional training. When I sat in the course, it was just light bulbs and fireworks, and oh my gosh, this is me, this is my family. I had a brother that died of SIDS, and I witnessed that. And all of the
mm.
things. I have brothers that struggle severely with sleep and addiction and mental health and all the things. And my kids couldn't breastfeed. I struggled my whole life with sleep breathing disorder, anxiety. I had nose surgery, I had tonsils out, you name it.
Wow.
And so, my experiences are heavy, and I wear them, and that's how I see, and those are my lenses that I see our patients through. So I want to be that person that's advocating for you, for your family. I don't want anybody to be the mom that, I felt like helpless and couldn't breastfeed and didn't have the support. And that child that's growing up anxious and nightmares every night, being scared and shy and, you name it. So that's why I'm here, and that's my purpose. And I feel like this is my calling. And so I left clinical dentistry probably 5 years ago almost, and just solely dedicated myself to opening this practice because there wasn't a lot of those in the valley. And now
Mm,
it's really blown up. Where Phoenix has grown incredibly. And so we
right.
have seen a big shift in those providers that are focused more on airway. And it makes me so happy that we have support out here. And I have referring providers to refer to. And it's just been such a shift in the last 5 years. And so our practice also incorporates different scopes and different lenses. So occupational therapists and speech therapists and dental professionals. So we all come together to look at these individuals through different lenses, but also through a foundation of that functional and airway lens.
I love that. And I love the cross-functional. We are
Yes.
such huge advocates for that. And I love seeing it in
Yeah.
action.
Yeah.
Um, yeah, go ahead.
Yeah, I was just going to say it's definitely become where you see the pivotal points, and some practices are solely focusing on what they can do, and nobody else can join in, and it's disheartening. So
Yeah,
that's another point of view, is we definitely want to work more together and collaborate more as a unit, because at the end of the day, we're all here to help people.
absolutely. That's it. That's exactly what it is.
Yeah.
And I'm gonna just kind of let parents know before we really dig in here. There are a couple of videos that they really struck me when I saw you in them. So I will be putting those links in the podcast
Yeah.
notes, and encouraging parents to check those out. So, over the last couple of years, we've talked to quite a few myofunctional therapists, and I think for the most part, parents really understand what the goal is, what you do, what treatments are offered. So we're not going to focus a lot on that today. I'll put some links to some of the more popular ones in our notes. Um, with you, because of the things I've heard, I would really like to focus a lot on mental health in children and how sleep and breathing play a role in.
Yeah. Yeah. It's what the more and more I find the connections between sleep, breathing, and how well our brain works and how well we respond to the world is astounding, that this isn't part of risk assessments and well checks and exams, especially with what's going on in the world right now. We're seeing a huge problem, for lack of a better term, in caring for these people that need more support and are struggling a lot with mental health. And it doesn't just start when we become an adult and get our first job. It starts
Right.
when we're young and we're sitting in kindergarten class and we're shy and we're anxious because we're not getting a lot of sleep at night, and we're not able to sit and focus, and we're not able to sit and read and focus on the connection with our brains and learning because our brain isn't getting what it needs night after night. And then, I feel like there's a lot of propensity to push these kids into looking into stimulants and being diagnosed with ADHD. And there's a lot of teachers that I love teachers, and a lot of my family members, my sister is a teacher, but it shouldn't be a diagnosis from
Mhm.
education professional. And there's so many different needs for so many different kids, but if you look at the foundation of it, is how is our brain reacting to our breath that we're taking in and out, and how is our brain reacting to the quality of sleep that we got the previous night.
Right.
And so when we're seeing these kids present with these issues, with the, inattention and focus issues and memory issues and, emotional regulation, there definitely needs to be a conversation about what referrals to put in place. And in my research, seeing that there has been something in place for pediatric well exams, but there's, I can link it here too if people are interested, but there
Oh,
is
yes, please.
probably, there was a big article about pediatricians and, needing to screen for sleep disorder breathing and using snoring as a diagnostic marker. And in about 1,000 of those surveyed, from 1,000 electronic medical record charts, only a third of those were asked or screened for sleep concerns at the well checks,
Wow.
even though it's a standardization through the American Academy of Pediatrics. So, if 1,000 kids are coming in and only a third of them are getting asked what their sleep quality looks like, we're missing a ton of kids. And this isn't,
Mhm.
this is 1,000 charts. So
Mhm.
how many kids are we really missing out on?
Right.
And really what this article and this research is showing, that the pediatricians don't find that there's enough time, and they don't have enough tools to know what the next step is in the referral process or what to do about it. So, that alone is saying a lot. And I know that's a big hurdle for a lot of professionals, is what's the process? Because there is no protocol.
Right. Right. And that's what I was going to ask about is there are so many, because you and I know because we're in this field, so
Mhm.
many conferences and webinars around, we work with Airway Health Solutions and they have training,
Yeah,
but these are for dental providers and pediatricians and myofunctional therapists that are already out there,
right.
and we still have to pull in the hygienists and and honestly, you do have to educate the teachers and the educators because they're, on the front lines with these children. And we have to tackle parents. And that's the part we work on. How are we missing this though in the medical realm? If all of this is out there and this science is not new, how
It's
are we
not.
missing it?
That's a great question. I think we all ask that. I don't think we really know exactly what the answer is, but in my opinion, and this is my opinion, is, we all have experienced, the short changes in the medical world. We've all been in that exam room where we're waiting 2 hours for a doctor. We've all been, mishandled in regards to like referring and the referral process and billing. Like, we've seen it, we've all experienced it. And so
Right.
that's the spillover. That's the spillover, the continuity of care. And so where I feel that there's some value in is really these parents are amazing. And you know this, putting all this information out
Mhm.
for the parents.
They're
And
hungry for this information.
absolutely, because they know parents, when something's wrong with their kid, they will travel the world and back to find out answers to help their children. And so
Absolutely.
the more advocacy that we have, the more that questions get answered, the more education we put out there for them. Like this organization, which I applaud you guys, that's where we're going to have more standardization and integrating more in that medical and dental model of protocols and risk assessments, because we're asking for that. And I think there needs to be more advocacy for sure. The other thing that I can see is, we looking at the model of education with these, pediatric residents in dentistry and in medicine, there is a lot of discussion on sleep. I don't think there's specific training, not to my knowledge. If anybody else knows if this is actually discussed in school or the training or the education, I know they talk about tonsil and adenoid enlargement being
Hmm.
causation and a huge risk factor for sleep disorder breathing. But then if you look more at the research, it's not effective in stopping sleep apnea or improving sleep quality greatly. I want to say 69 to 70%. It doesn't have that response that the surgery is wanting to do. I am a product of that. I had that surgery when I was little, and I don't remember my sleep ever getting better. So, there's a lot to say with that. And if that's been the answer for the referring protocol when a child comes in and the parent's complaining about their sleep,
Hmm.
it's not the right model. So what can we do to educate these dental and medical practices? And when I go out, and I encourage every medical and dental professional that wants to know about airway and sleep, find a myofunctional therapist in your area. And I hate to
Yeah.
keep saying that because that's what I represent, but honestly, we do so much above and beyond in regards to researching and
Hmm.
finding out more information, and then being almost like a tour guide of what needs to happen next and who to connect with. And
Hmm.
because a lot of us don't have that, insurance model and that medical model, we are spending a lot of hours with the boots on the ground and calling offices and inviting ourselves in to educate these offices about what it looks like for airway and sleep and breathing disorders. So that would be awesome. If you're wanting to know more, connect with a myofunctional therapist or somebody, an airway dentist, or somebody that's willing to, because we love talking about this, to come into your office and educate you on what you can do to help your patients and support your patients.
Yeah. And I love the way that you called it a tour guide. I've also heard that, the other one that I liked is you really are the linchpin because
Yeah.
if you just put a pin in you, it goes off to everyone. You're the one that connects everybody. But
Yes.
there's not a lot of myofunctional therapists. I know it's still up and coming, and not everybody can. I've heard you speak to this. Not everybody can train to become a myofunctional therapist. So just take a step for it's kind of a side step, but
Yeah.
who qualifies to even go through this training?
So it's important to say that there's no exact organization that's in charge of organizing and reining us in, if you will.
Okay.
So there's lots of offerings and training, and even more so now. And my avenue that I took was through the International Organization of Orofacial Myology, the IAOM. And under that organization, at the time I took my course, was licensed dental hygienist and speech language pathologist. I know they have opened it up to also some acceptance of PTs and OTs, which I feel that's super valuable, because
Okay.
the more eyes, the better. These
Yeah.
PTs, these OTs, they're seeing this in action. They're seeing this every day. They're treating people with TMD. They're treating kids with sensory concerns and feeding concerns. So I think it's super valuable to have them also learn about airway and oral function and oral facial function. There are some other courses that you can take through different organizations. I mean, there's so many out there, I really can't keep track of, quite
Yeah.
honestly.
Yeah.
And so I would love to see more organization within the field, and more standardization.
Yeah,
quite
that would
honestly.
that would be great.
Yeah.
So I want to come back a little bit, because we talked before we started taping, we were talking a little bit about mental health.
Yeah.
Um, we both have had our own journey with that. We both have had our own airway journey, and we've had it as parents. So,
Yeah.
um, and before we really get into this, I say this just about every podcast. This is the point where I will tell parents, just take that mom guilt. Let's just put it to the side, check it. You don't know what you didn't know. You did the best you could. Here's where we are
Yep.
now. Let's move forward. So, because we all wrestle with it once we find all
Absolutely.
this out.
Yeah.
Um, really digging into mental health. You have because it is, I think it's surprising for a lot of parents to realize sleep and airway can really impact these littles when they're teeny.
Yeah.
Um, so as a parent, what are you looking for outside of just snoring? What are some of the other signs? And when you find them, what do you go, what's the right way? Because you don't want to go in and, hey, doctor, you have to do this. How
Right.
do you present this? What's the right discussion that opens it in a productive way?
I think when you're talking about younger kids, you definitely want to keep an eye on anything that's out of the norm. And when I say that, that's a broad term, but moms and parents know their child and they know what's normal for their child and they know this doesn't feel right. So
Hmm.
when you have a kid that's becoming more dysregulated throughout the day, so for example, they are becoming more angry or they're becoming more physical with their siblings or peers. There's more outbursts, more outbreaks, more breakdowns. We've all had that toddler who throws themselves on the floor because they didn't get
Hmm.
the candy in the candy aisle at the grocery store. But is that
Right.
happening more and more and more? Are you having a hard time calming them down? When you go to do homework after school, or is it more frequent than not where we're not able to get through a homework session without a complete fight? Do you dread doing that? Does your child dread doing their homework? Does your child dread going to school? So those are all things that you want to look into. Are they isolating themselves? Are they anxious? I spoke a little bit with you about, my family history, and I remember my brother would throw up every morning before school, and
Mm.
their sleep, he has sleep breathing disorder. And so anxiety, emotional dysregulation, more frequent breakdowns, tantrums. And I see it more, and this is just my opinion, is I see it
Mm.
more like 4 or 5. Four,
Okay.
5, 6 is where I
Is when it
see that.
starts.
Yeah, when I talk to parents, that's kind of like the collective age that I'm hearing. Oh, I've noticed it happening more at those ages. I just had an adult client in last week, and she said that when she was younger, she was brought to psychiatrist after psychiatrist about possibly having schizophrenia. And
Oh,
if
wow.
because she had such a swing in her moods and behaviors and focusing, and then that makes me super sad, because think of the medication that they use to
To
treat that.
regulate that. Sure.
Yeah. And I mean, that's the next question the physicians should ask is, what does this child's sleep quality look like? And so as a parent, when you bring your child in, if your first course of action is to bring him into the pediatrician, like I said, they should be asking about the sleep, and they're mostly what their protocol is ask about snoring and mouth open posture. So
Hmm.
definitely discuss that with your pediatrician, and then ask for a referral. And that referral could look like seeing an ear, nose, and throat doctor. It could look like seeing an allergist, because we have to make sure that the way that they get oxygen to the brain is open and available and ready to do so.
Sure.
So
That makes sense.
that's the anatomy of
Yeah.
the nose, the pathology, and the structures supporting that. So if your course of action isn't going to lead you pediatrician to ear, nose, and throat doctor, then it's best to search for a dentist in your area that's a pediatric dentist or an airway trained dentist that can help guide you and kind of point you in the direction of what routes and what steps you can take. And then, like I said, going back to orofacial myologist or myofunctional therapist, there's a lot that you can consult with over even virtually if you don't have close access to care.
Hmm.
And that therapist can do some research or get with colleagues that are in different locations and try to put a team together for you and your family to really get down to the root cause of what's going on.
Yeah. And I like that. And that, I mean, you just totally set up the transition perfectly there. That's really what we're talking about too, is get to the root cause, because so much of medicine, and again, not their fault. I have to
Right.
say that every podcast too, right? They were taught what they were taught
Yep.
and they're doing the best they can, but it's all reactionary. It's,
Yeah.
oh, we see this, let's treat this symptom, let's treat this symptom. And really, it's this paradigm shift that we need to have of, let's talk about the root cause. Why are you having that symptom? Let's back all the way up and see what it is. You know,
Yeah.
how do we change that mindset?
Well, I think this is a plug for Peter Attia's book Outlive, and I just listened to that and it's great, and I follow him, and he's got a lot of great points, and he looks at medicine differently, and he's a doctor that specializes in longevity, and he talks a lot about medicine 2.0, which is the traditional model, what we're seeing, and what medicine 3.0 could look like is more of a prevention model. And so that's interesting to me because in dentistry, we're all about prevention. And when there's that
Mhm.
crossover in medicine, I think there's a lot to learn from each other. And so us advocating as a whole, as a group in the public setting, as parents, as family members, and asking, well, why does my child, asking your provider that question will get them to think about it, and we'll get them to research it, and we'll get them to find out, how can I provide these answers and a treatment
Mhm.
protocol for these families and patients? And so it goes back to saying, like, we're going to have to make some noise about
Yeah.
what we want and what we're needing to get back down to is root cause treatment, and not just putting band-aids or treating the problems that we're seeing. And
Right.
so advocating. And once again, if more of us can get into these offices, and, we also have to tread lightly, because if they're not willing to hear it, they're not willing to hear it, but it's not going away. It's definitely
Yeah.
going to be talked more and more about. And we're seeing more mouth tape on the market, and, and the straw that strengthens your tongue. So there's more of that awareness in our general population now, more so than there's ever been. So
Mhm.
we're going to kind of infiltrate these providers with, hey, we need to find out a little bit more of the why. So let's do it.
Yeah, yeah, and we call it arming the airway mama bears. Just give them the
Yes.
information and let them go ask questions,
Yeah.
and we just have to push it through. So when it comes to this transition, where do you see, just for lack of a better, I don't know what to label it, airway and sleep medicine? Where do you see it in the next 10, 20 years? Just because of the
Yeah.
changes we've made in the last 5.
I would love to see a model where dentistry and medicine cross over in regards to airway support. And so
Yeah.
if pediatricians and dentists are local, and a lot of them are, I know, working in a pediatric office, we had pediatric offices that we worked with a lot, and we worked with their staff. So if we're co-treating these families, for lack of a better word, co-treating them, meaning pediatrician sees them in office for a concern, say a 2-year-old mouth open, snoring at night, hot and sweaty all night, waking up multiple times, lots of tantrums, lots of meltdowns, all of the things, and parents go to pediatrician. Pediatrician has somebody local that they know they can connect with and say,
Mhm.
hey, I don't know all the things, but everything you're saying is checking off some alarms to me that we should explore this more. And then making sure that this child has that dental home, and the dental home has risk assessment tools that they're looking at in regards to the structure of this child's mouth, the
Mhm.
proximity of the primary teeth, they can also look at the oral structures with a visual exam and see if there's enlargement in the tonsils. I think much better than, no shade to pediatricians, but we know how to get in the mouth, and we know how to be
Right.
effective at getting in the mouth and getting out. And so, looking at tonsils, looking up the nose, can we see inflammation, swelling of the turbinate tissue? Are we seeing venous pooling or dark circles under the eyes? And the crossover of using more support to get more answers, and then having that protocol, that referral in place in that process.
Yeah, that's fabulous. And kind of to your point, it's when everybody has their lane, they have their expertise, and we're not saying, don't get out of your lane.
Right.
That is your expertise. What we're saying is there a way you can put the lanes together so we're driving stronger together in the same direction?
And support is
Yeah.
huge when you're in, healthcare and you're a provider and you are kind of on your own. That's something that kind of weighs heavily on that provider too.
Oh,
And
sure.
when you have support and you have somebody you can call and somebody you can bounce things off with, the more eyes, the more brains, the better for everybody.
Yeah, absolutely. And for any of our providers that are listening, I'm also going to put links to 2 conferences in particular for 2024 that you may want to check out. Actually, there's 3 because it is all about collaboration.
Yeah.
There's the Airway Palooza, there's the SEC sleep conference, and then of course Collaboration Cure. So those are all ones that we highly recommend and promote. And because again, like you said, it's all about collaboration, because then you can better support the child.
Yeah, and those conferences are great. And when you go and you're sitting next to PTs and dentists and physicians and chiropractors, like you feel like, oh, I do have support. I'm not alone on this little island out here, promoting health, wellness, root cause, airway. And so, it's a good place to go to really give yourself that almost that recognition that you need to have that motivation, if you will, like, because it's a lonely field. Not a lot of people know, that what's it called, the water cooler talk of myo and airway.
Right. But we're working on it. We're trying.
Yeah.
We're trying. Absolutely. So at the end of every podcast, I always like to hand it back over to our guests, because y'all are the experts, and give you the final thought or message or takeaway for our parent audience.
Yeah. So I would definitely want to empower our families and our parents by advocating for themselves and their kids. And also, as a mom that struggled extremely with my mental health after I had kids and before, don't be afraid to ask for help, and don't be afraid to ask for help for yourself.
Yes. Oh yeah.
When you have littles that aren't sleeping, you're not sleeping either. Your hormones are going to be imbalanced. You just had a baby, or you're kind of getting yourself back. You're still breastfeeding. So give yourself that support that you need to be in the right place to make those decisions for your family or your kids. So that's my biggest takeaway is, mom, support yourself, love yourself, give yourself what you need, and then be an advocate for your kids, which I know you will be, but don't stop asking those great questions, and don't stop asking the why and getting to the root cause.
That was just so well said. And thank you for saying that, because as moms, we forget. It's not a martyr thing. You just forget. You get so focused.
And you need to have that. I always tell, like, I'm going to give you permission. It's okay. Like you kind of have to hear, it intellectually, but you kind of have
to hear
somebody else, like, give me permission. Give me permission.
Yep. Absolutely. Thank you so much, Kelley.
Yeah, of course.